All right, I hope you all can hear me. Good afternoon, good morning, good evening, depending on what time you're joining us and where in the world you are. Thank you for joining our webinar. My name is Mona. I hope you all can hear me. Good afternoon, good morning, good evening. And there, sorry, was feedback. I apologize. My name is Mona Bormet, and I'm the Program Director at Christian Connections for International Health. Based in Washington, D.C. area. We are an international network of 150 Christian organizations. About 50% are headquartered here in the United States, and about 50% have headquarters in other countries. And our mission is to promote health and wholeness from a Christian perspective. So we know that hunger is a common theme in the Bible, and one of the most well-known verses, "For I was hungry and you gave me something to eat. I was thirsty and you gave me something to drink," from Matthew, implies that we serve Jesus himself when we feed the hungry. And so today we're going to talk about what does feeding the hungry look like in our programming, and what can we do on a broader scale to encourage policy and an environment that helps prevent famine and improve nutrition for the world's most vulnerable people. So we are together today to discuss global nutrition and the work of faith groups, from programs to policy. And so logistically, I'm going to introduce each speaker, and then we will hold all questions until the end. We encourage you to please use the chat box in the upper right-hand corner of your screen to ask questions or leave comments. For those of you who are having problems, we suggest you use Chrome as your browser and be signed into a Google account to ask questions. So our first speaker is Nicole of Food for the Hungry, who will share what nutrition looks like within FH's Food for Peace, Title II, Development Food Security Activities Program. So Nicole, I'll turn it over to you. I'm going to ask you to remember to please turn on your microphone, and I'll mute myself, and welcome. Thank you.
Thank you very much, Mona. Good afternoon. As Mona said, my name is Nicole Coglianese. I am the Senior Health and Nutrition Technical Advisor for Food for the Hungry. Food for the Hungry FH is a Christian NGO. We operate relief and development programs in over 20 countries across Latin America, Africa, and Asia. We seek to find solutions that are innovative and community-specific, with the purpose of empowering children, families, and communities to invest in their own development. FH works with communities to respectfully bring new practices in agriculture, health, and childhood development to create sustainable practices. FH's work focuses on 4 key sectors to address the underlying causes of hunger and malnutrition. This includes health, adult and early childhood education, disaster risk reduction, and agriculture and livelihoods. FH's nutrition work touches on all of these areas to ensure that the root causes of malnutrition are addressed. Our nutrition work includes improving access and availability of food, sustainability, water, sanitation, and hygiene, or WASH, and ensuring the production of nutrient-rich commodities. FH seeks to improve food and nutrition and income security and needs of the most vulnerable populations through a multi-sectoral approach that increases availability of food and household income and improves the nutrition and health status among adolescent girls, women of reproductive age, and children under 5 years of age, with the focus on children under 2 for the first 1,000-day window. Nutrition interventions that address the direct causes of undernutrition, such as addressing inadequate dietary intake or using food aid and supplements, are nutrition-specific interventions. These are essential but are not enough to tackle the problem of malnutrition. Long-lasting behavior change at the household and community levels are also required in order to address these underlying causes. Agriculture, health, education, and protection programs, while they do not have nutrition as the primary objective, they do have the potential to impact nutritional outcomes if nutrition is considered in program design. These are what we call nutrition-sensitive programs that can address the underlying factors that contribute to malnutrition, such as food insecurity, gender inequity, poor knowledge on feeding and healthcare, and limited access to safe water and health services. These programs also serve as a mechanism for delivering nutrition-specific interventions, such as the delivering of nutrient-dense foods or Title II commodities. So FH's Title II experience in brief. FH has began working on Title II programs in 1998 and has since implemented 12 programs in Mozambique, Kenya, DRC, Ethiopia, Rwanda, and Burundi, South Sudan, and also Bolivia. FH is currently implementing the DFSA, the Development Food Security Activities, in Ethiopia and DRC. FH partners with USAID's Office of Food for Peace to implement the Development Food Security Activity Program. The DFSA is a multi-year program, typically about 5 years. It is a US-funded international assistance program that is designed to address the root causes of hunger, food insecurity, and malnutrition. The DFSAs include the nutrition, agriculture, livelihoods, gender, security, and disaster risk reduction sectors. FH incorporates this unique strategy into execution of the DFSA program to reach the most vulnerable individuals in these countries, specifically pregnant and lactating women, women of reproductive age, children under 5, and adolescents. While FH uses a variety of methods to disseminate nutrition-specific and nutrition-sensitive messaging, the primary method to invoke lasting behavior change at the household and community levels that FH uses is the care group model. Care groups are peer-based health promotion programs that can quickly and effectively improve health behaviors and outcomes in communities. This is done by empowering mothers and local leaders to disseminate high-impact solutions to childhood malnutrition and illness that are simple, low-cost, and community-derived. For more information about care groups, you can go to that website right there, www.caregroupinfo.org, for sample modules and lesson plans that we use around the world, including flip charts and lesson plans that are open access and available for other NGOs to use. The lessons are presented using visual aids and consist mainly of pictures, as the target populations are not always literate. Images are context-specific, and illustrations are created specifically for each field. So what does a care group structure actually look like? This is just a representation of what a care group structure looks like. It's a group of 10 to 15 volunteer, community-based health educators who regularly meet together with project staff for training and supervision. Each volunteer is responsible for regularly visiting about 10 to 15 of her neighbors, sharing what she has learned and facilitating behavior change at the household level. Care groups create a multiplying effect to equitably reach each beneficiary household with interpersonal behavior change communication. They also provide the structure for a community health information system that reports on new pregnancies, births, and deaths detected during home visits. As this image shows, each promoter reaches about 500 to 1,200 women. It depends on the context, if it's urban versus rural, and the population density. The coordinators, supervisors, and promoters are FH employees, and the care group volunteers, lead mothers are members of the community in which they serve, and they reach out to their peers to disseminate the messages. There are a number of nutrition and maternal behaviors that are proven to reduce childhood malnutrition and death and can easily be addressed using care groups. For example, breastfeeding, appropriate complementary feeding, and water sanitation and hygiene behaviors that contribute to improved nutritional status, and the prevention of pneumonia, diarrhea, neonatal infection, and other illnesses in young children. Food for the Hungry has found that this care group structure has been extremely effective and sustainable in our communities. For example, in Mozambique, FH found that 93% of volunteer women were still active in disseminating nutrition messages in their communities 20 months after the formal project ended. FH has also seen care groups continuing to operate in DRC, Democratic Republic of Congo, after the completion of FH's involvement in the communities. So that's been very exciting for us to see. And before I conclude today, I just wanted to go over some specific lesson plans and topics that we use in the field. This specific list is for DRC. FH uses the care group model to increase utilization and access to health and nutrition services. There's a focus on the adoption of essential nutrition actions and essential hygiene actions at the household and community levels to address stunting, poverty reduction, and underweight of children, as well as a renewed emphasis on linking with existing USAID-funded programs to scale up the management of childhood illness at the community level. So here's the list that are covered through lesson plans using the visual flip charts to communicate the nutrition messages. The first one, essential nutrition actions, include topics of maternal nutrition, anemia prevention, exclusive breastfeeding, and early breastfeeding. These activities are essential for optimal nutrition, starting from conception and early childhood, specifically for the first 1,000 days when we can prevent long-term malnutrition. Essential hygiene actions are behaviors focused on the treatment and prevention of diarrhea, baby-focused water sanitation and hygiene, or baby wash, water treatment, hand washing, and proper feces disposal. Essential hygiene actions relate to nutrition because when children are undernourished, they have lower resilience to infection and are more likely to die from diarrheal diseases and respiratory infections. Frequent illness depletes the nutrition status of those who survive, which creates the vicious cycle of recurring sickness and faltering growth. A reduced growth rate, known as stunting, is a primary manifestation of malnutrition in early childhood, particularly malnutrition during fetal development due to malnourished mothers. The first 1,000 days of life, from conception to the child's second birthday, are particularly critical in fetal and childhood development because children are vulnerable to adverse and chronic effects of intestinal disease brought on by poor water and sanitation. Just as a side note, in addition to care groups and DRC, FH is partnering with Johns Hopkins University to conduct research and a randomized controlled trial aimed at preventing geophagy and environmental enteropathy, which contributes to stunting. Geophagy is basically the ingestion of pathogens in the soil and animal feces that destroy the lining of the gut. This leads to a condition called environmental enteropathy, which is a chronic intestinal inflammation. This can lead to malnutrition, anemia, stunting, and impaired development because the intestines are unable to absorb nutrients properly. Next down on the list, complementary feeding. Complementary feeding involves appropriate first foods for children and is meant to complement breast milk for the first 2 years of life. Topics covered in this module include child feeding, dietary diversity, growth monitoring, consumption of vitamin A-rich foods, and food safety. Next, we cover malaria treatment and prevention, as well as infections and childhood illness. This is related to nutrition because disease increases the nutritional needs. Timing and spacing of pregnancies is an essential topic to cover because women who give birth too early, under 18, or have babies too close together are more likely to give birth to malnourished children and contribute to maternal malnutrition. Maternal care also includes antenatal care visits, newborn care, and encouraging deliveries in clinics. Essentially, healthy mothers give birth to healthy babies. Malnourished mothers are more likely to give birth to stunted children because adequate nutrition for babies begins at conception and during pregnancy. And maternal care also decreases maternal mortality, which is essential as well. So thank you very much for this opportunity to share a little bit about FH's work in the field of health and nutrition. FH seeks to find solutions that are innovative and community specific. We want to empower the children, families, and communities to invest in their own development. Thank you very much, and happy to answer any questions.
Thank you so much, Nicole. I really appreciate it. Very interesting presentation. I have plenty of questions, and I'll remind people to please write any questions you have in the chat box on the screen. It helps if you are signed into, you're using Chrome as your browser and you're signed into Google. For now, we'll transition to Ryan Quinn of Bread for the World, who's our second speaker. I'll remind Ryan to unmute himself and to turn on his video. Ryan will discuss how legislation facilitates the United States' work on global nutrition and other hunger issues. He's going to explore reforms to food aid programs that would strengthen this work and steps that we can all take to encourage our representatives to support these changes. So Ryan, I'll turn it over to you. Welcome.
Great. Thank you so much, Mona. I appreciate that. So to follow up on Nicole's presentation, while there are, she talked a lot about the programs and the actual implementation of a lot of these interventions. I just wanted to give a little bit of a more 30,000-foot look and see how does public policy and specifically U.S. policy in the area of nutrition impact this, and what have we been doing? So, to look at the present day, where are some of the legislative initiatives and policy priorities currently moving? How do they impact nutrition? So some of the stuff happening right now is the Farm Bill that recently came up for a vote in the House last week. There's a lot of debate about the domestic priorities in there, but on the international stuff, it also deals, that bill specifically does do a lot on international food aid and has impact on nutrition policies. We've been dealing with global issues, global crises, so famines in South Sudan, Somalia, northern Nigeria, Yemen have been some of the worst in decades, as well as man-made crises in Syria, Rohingya in Myanmar. So these crises facilitate and show the impact that these types of programs that we're doing don't need to be scaled back, but actually need to be increased. That said, looking at the budgetary environment and the political environment that we're in. So, we are in a Congress and an administration that does really look very closely at discretionary funding and has really been trying to cut back on funds. The administration has continually put up a number of budgets that have cut back on a lot of these programs, but there are champions in Congress, and there has been sustained funding for the last couple of years. So more broadly, looking at funding of nutrition programs, since the 1970s, the U.S. government has had priority for U.S. global nutrition and has funded these programs. More specifically, in about 2008, there was a global food price crisis, and that's really when they were looking at a lot of this stuff. So the Lancet published an article in 2008, and the U.S. government really started to look more closely at some of these things. So they've been funding a lot of these programs. The other thing we want to talk about just is improving these programs. So while we do fund nutrition programs, there are ways to continually reform them and modernize them, and so they reach more people and have better impact. So looking at the progress that's been made since 2008, there's been a decline of about 3.9 million. The malnutrition of child deaths due to malnutrition was 3.9 million. That's lowered to 2.6 million in 2006. There's been a huge decrease in stunting of children. It was 165 million down to 155 million in 2016. So a lot of this is very directly impacted to U.S. policy and U.S. intervention in these areas. Like I was saying, the U.S. has been a leader in pioneering nutrition research and building up evidence on nutrition since 2008. They have really been focusing more on this. Due to that food price crisis in the Lancet article, there was a scaling up nutrition movement started. A lot of that too was focused on, what Nicole had mentioned, the first 1,000 days of life, 1,000 days movement, really trying to focus on maternal and child nutrition in those first 1,000 days. And prioritizing key interventions and funding for those. Additionally, there was a nutrition and global food security initiatives, and the U.S. government worked on something called Feed the Future. So this was a program really focusing on agricultural interventions, and a huge part of that was nutrition. So looking at development programs and how do we help make these programs sustainable, but also improve them so that nutrition interventions and nutrition is being prioritized in those. As part of that, Congress came along after Feed the Future started going in 2010. In 2016, the Congress passed the Global Food Security Act, which helped codify that that program and really try and make it both more targeted and really focusing on the nutritional aspects of that. So finally, the U.S. government has started a strategic global nutrition strategy and have been efforts over the last few years to use that. So looking at where are some of the policy things that have made a difference? There's been an increase in nutrition funding. In 2008, the global nutrition account was at just 75 million. Over the last few years, they've been increasingly increasing that account. Nutrition specific is at 125 million, but there's also been an increase into the more nutrition sensitive interventions in other programs. You know, we've been looking more targeted over the next year or two too, and trying to see, yeah, is there room for further increases, and where could those go? And I think, you know, there definitely could be, and given some of the more specific targeted interventions Nicole talked about, some of the programming, I think we could see some huge decrease, even larger decreases in stunting and malnutrition. So the other thing is that there have been reforms to existing food programs to try and make them more effective. So in the 2014 Farm Bill, there were efforts to look at international food aid, which since it was started, the Food for Peace program in 1950, these programs give out emergency food aid, and it's always been in the form of commodities. So U.S.-based, you know, corn, rice, soy, shipping those overseas and giving those to people. Really, over the last couple of decades, there's been modernizing of those programs. So while commoditized food is important, there also is an effort to complement that with more locally bought foods that can both make it quicker to get there, but also there is a lot of nutritional value to that. Adding a local diet that's more familiar to people and that can include more nutritional value in them. So, and there have also been, besides the Farm Bill, there have been bills going on to try and modernize some of these food aid programs, and looking at the existing Farm Bill to see where things are at. So looking at the next slide, the overall budget. So despite the current progress, you know, we have had a huge decrease in stunting and malnutrition. According to the 2017 Global Nutrition Report, there really hasn't been enough done to achieve our global nutrition targets of ending malnutrition by 2030, and even reducing stunting over the next 5 years. There's going to need to be a more targeted increase and a scaling up of a lot of these programs if we're really going to meet those targets. So, you know, the packages out there are already, the package of interventions is already out there. We know the things that work. You know, we look at the programs like the ones Nicole was talking about. These are really basic and simple interventions. They don't take, you know, a lot of new inventing. We know what's out there. It's really just investing in these, and for small amounts, you really can get a big bang for your buck and achieve a lot in return. So look at the. Yeah, so the other thing is some of these food aid reform proposals. So when we modernize food aid, how can we also make some of that emergency food aid that's in the form of commodities, how can we make that a little bit better? Some of the things that we are doing, there is an effort, and in the recently passed House Farm Bill, they removed the requirement to monetize food aid as part of Food for Peace. So this is a process where they just take food for development programs, bring it into a country, and then sell that food on the market, and use that money to do targeted interventions and development programs. By not having to monetize, you know, we don't overwhelm markets with foreign food, and also we can use more of that money for the implementing of programs. So more nutrition-specific programs, there will be more out there. Additionally, by using having flexibility in some of these food aid programs, the ability to use more local and regionally purchased food, or even food vouchers, it makes the dollars go a little bit further. You can use this, you can reach more people, but there is really a nutritional component to this too. You can have local food that's easier to process for some of these families, and adding diversity to the diet has an increased nutritional value. And finally, there's an effort around cargo preference restrictions, which currently 50% of all U.S. food aid has to be shipped on U.S. flag vessels. Unfortunately, U.S. flag vessels don't sail to a lot of the places where this food is needed, looking at West Africa and others. So there's efforts to change that. Go to the next slide. Yeah, so as I mentioned before, why is this important? Diversifying these, it offers a diversity in diet, which is especially important for kids at an early age, as well as, looking at the context, the market development, and the real resiliency of these households who are trying to make a living via farming. We can go to the next one. Yep. As I mentioned, a lot of this is allowing for more local foods to be used as part of food aid. So it can make it's more nutrient rich and has more diversity. Go next. Yeah, and so this is just a little bit of a chart showing, if you do a couple of these things, how does it impact? The three big things is that it reaches more people, which is helpful. It reaches them faster, which is certainly more important in an emergency, and it reaches them with more nutritious foods. Right. So just some discussion topics for questions folks have later. Looking at the overall budget, the budget for these programs, and ways that we can improve that, and really focusing on the Farm Bill. That's coming up, and pushing for some food aid reform provisions in those. Looking forward also is the Global Food Security Act. That's coming up for reauthorization this year, and we're really trying to get members to co-sponsor that in order to continue to move that forward, and some of the nutritional benefits that offers. So it's HR 5129 in the House and S 2269 in the Senate, and continuing to push for co-sponsors. So it's another thing that we can do moving forward. So I can stop, but I'm happy to answer questions and go more fully into this on the Q&A.
Thank you, Ryan. And thanks, Nicole. I encourage Nicole and Ryan to both turn on their videos and their microphones, and we'll transition to Q&A. I really appreciate the perspectives that you both shared. I just want to remind people that you can put your questions in the chat box, and if you're having problems, I wrote my email and you can send us questions that way. But there are a list of questions already. Nicole, I'm going to start with you, if that's okay. You're there?
Yeah, yes, sorry, you're here.
Okay, great. So one of the first questions was, how does FH decide what communities to work in? Do you work with local partners, and for how long? I think they mean length of time do you work in communities?
Yeah, sure. There also seem to be some questions about how it was structured, so I'll try to tackle all those together, if that's okay. So we aim to reach the most vulnerable communities based on need, and we look for households with children under 5, the pregnant and lactating women, the reproductive age, including the adolescents. To set up a care group, what we do is we identify all households with children under 5 and adolescents, again, all these people that meet the requirements. Then we cluster them into groups of about 12 households in each project area. And then each project area elects a care group volunteer to represent them. So it's usually a woman in the house, in the community, that has some sort of influence over her peers who people respect. Then we give her the lessons. We provide her with all of the materials that she needs, including training, that she will then share with 10 to 15 of her neighbor women to start facilitating the behavior change at the household level. They are met up with every 2 weeks with the health and nutrition promoters for supervision and additional training. And then they meet with all of their neighbor women once a month through formal structures, and then once a month through just household visits to be able to answer questions and have the interpersonal connection. So that's a little bit more about how the care groups are structured. I'll go down to some of the other questions that they
So
had.
not
To go to length, right?
Not everyone can see the question, so let me ask them.
Okay.
So the next question was, who creates the images that are, you mentioned, are context specific? And another question was, how many languages are the lesson plans available in, or curriculum, and are they open access, or is there a charge to use them?
Okay. Yes, we work with local artists mainly, whether or not they're from the country or at least from the region. So we hire the artists based on where we're going to be working, so that the images relate to people, so they can understand. They look at a picture and say, okay, that looks like me, that looks like my neighbor, that looks the fabric that is used is culturally appropriate, the fabric of the woman's clothes or whatever it may be. There's no charge. They are open access. We do ask that you keep the logos on to give FH the credit for the work. And they're available in Swahili, French, and Spanish, depending on the region. I think those are the main languages at the moment. Yeah.
That's great. Okay, so Nicole, I'm going to give you a break for a minute and ask Ryan a question. So Ryan, someone asked, after following your presentation, how can an FBO work on influencing the policy level with donors like USAID, UNICEF, or the World Food Program?
Sure.
That's such an easy question, Ryan.
Yes. No, I mean, I think there are a lot of ways that we can influence policy. I think anyone can certainly influence, just looking at some of the more basic stuff, looking at legislation moving now, looking at your member of Congress. It doesn't have to be an FBO. I mean, individuals certainly looking for continually have co-sponsors on the Global Food Security Act. So these programs and Feed the Future are critical to nutritional interventions and really vital to moving forward on food and nutrition security, especially in the development regions. So asking your House member, your senator to co-sponsor this bill, I think, is a huge step forward. Additionally, funding for these programs by the U.S. government. It's not just about the U.S. funding these programs and the actual programs themselves. By funding these programs, the U.S. shows that they're prioritizing it. It leverages dollars, so it certainly leverages dollars both in the private sector for faith-based organizations like ours here, those working in the field. It helps them as well as international donors. So by showing that they prioritize these programs and fund them, it shows other international donors that this is a priority and encourages funding in those. So, if you're in the U.S., again, have a congressional member or senator, asking them to fund a global nutrition account to increase funds for those and not to cut them is certainly a step that you can take.
Thanks, Ryan. So some people, those are good suggestions. They might ask for, so how do I do that? So is there a website? Is there something they do? Some people might be new to advocacy. So I'm going to let you think about that. And
Sure.
then I'm going to transition back to Nicole for some questions. So Nicole, someone has asked, how are the village groups structured? And I know you talked a little bit about this. I think maybe they want some more details. And then someone also asked, has FH tested this kind of approach in emergency situations? And are there any results from that?
Mm-hmm. Sure. So the structure is the grouping of the households, about 12 households in each project area. Then each group of 12 elects a caregiver volunteer who then meets with 12 to 14 of her neighbor groups. So that's a little bit how that's structured. I don't know if that's exactly answering the question there, but happy to chat more about it, provide more information. And then the other question about emergency settings. We have used care group structure in emergency settings. It's much more pared down. So we usually focus on a specific issue or a message. For example, we did with the Ebola crisis. So we had very simple flip charts and lesson plans that were designed to be rapidly disseminated in the field. So they do take a little bit of time to set up the care group structure, to elect the women, to find the households. But once they're up and running, you can get it out pretty quickly.
And is that information also on the care group website?
Yes, we have Ebola and cholera on the care group website.
Okay, that's great. So Nicole, one of the other questions was, can you give us an idea as to the cost per beneficiary for care groups compared with other kinds of approaches?
Sure, yeah, easy question. It depends a little bit on the context, depending on if they are grouped close together, if it involves much transportation for the health and nutrition promoters out and to meet with the care group volunteers, but generally around $20 to $30 per participant for the 5-year project. As for other interventions, nutrition-specific interventions, like the food aid supplements, things like that, are much more expensive. I don't know if I can speak to exact figures here, but yes, the educational approach is far less expensive than providing the food aid.
Thank you, Nicole. So there's one other from Walter. How do you promote institutional and community sustainability of the care group strategy?
Mm-hmm. So one thing about electing the women, the care group villagers will represent who is going to be leading them, is that they already trust this person. They have complete faith in them, and so therefore they are more likely to listen to them, and then they're able to stay around a little bit longer. So like I mentioned, that our 90% of our care group volunteers were still operating 20 months after the project ended, which is pretty amazing. Just that they take this ownership on themselves, and they believe in it, and they want to help the health and nutrition and the long-term outcomes of the women in the community and the children. And just they take ownership. These women are very passionate and wonderful. So it's kind of a self-sustaining practice if you identify the right people.
Thanks, Nicole. Okay, I'm going to transition back to Ryan to give you a break. So Ryan, any more that you'd like to say on like a practical next step for all these different advocacy pieces you've talked about?
Yeah, sure. I mean, you mentioned, how do you do it if you don't know? I mean, I think on any of our organization's websites, a lot of us have actions. I know you can go to bread.org. We have our action center right there on our website, and you can click through and send an email to your House member or senator asking them to co-sponsor these legislations. Additionally, if you just want to go, you don't know who your member is, or you just want to call on your own, the House of Representatives website, you just go to www.house.gov. They have a Find Your Representative piece, and you can just type in your zip code, so you can find your House member that way. Additionally, you can just call the Capitol switchboard. They could transfer you to that office. They can transfer you, just tell them what state you're from and what senator you want to talk to. They'll transfer you there. So I think that's 202-224-3121 is the Capitol switchboard. So you're always welcome to call there. And yeah, just, it sounds scary, but it's really easy. Just calling your senator's office and saying, look, I'm a constituent. I'm from your state. Please co-sponsor this bill. Please support funding for these programs. And they have to listen. So they're representing you.
Thanks, Ryan. For those watching the webinar, what we'll do is have Ryan send us those suggestions, and we'll put that in the notes so you can see that in a written format. So Ryan, giving you a break, turning back to Nicole. Well, this is actually for both of you, but I'll go to Nicole first. So Jessica has asked, I'm wondering what the speakers feel is the most useful tool or approach for coordinating with local and international governments. to advocate for institution of these programs within the global context? We know that coordination is needed, but how do we actually gain it? So, Nicole, do you want to take a stab?
Sure. I don't know if I would say useful tool with coordinating with the local governments, except for direct communication with them, reaching out to representatives from the Ministry of Health is primarily how we interact with local government. By just communicating with them and direct contact.
Yeah.
Cool. Ryan?
Yeah, no, I mean, I'd concur, certainly. I mean, direct outreach, I think in looking at, it depends on the types of programming, Feed the Future, again, this Global Food Security Reauthorization Act, the purpose of these programs is, looking at how do we do our development and humanitarian aid in a different way, so that, instead of us just coming in and dropping some aid and leaving, how do we coordinate more? How do we make it more sustainable? So doing these types of programs where it's not about just coming in and dropping off aid, but we are coordinating with, local people on the ground, local communities, and seeing what is the best way that we can help you. So doing interventions like access to markets. So just basic things on how to do some of this farming stuff better, even looking at the food aid, how to provide more local and regional foods in some of these programs is a good way to be more coordinated in our approach on some of these programs.
That's great. Thanks, Ryan. So Nicole, I'm going to turn back to you. We've had a question come in that asks, do you do community assessments allowing you to identify other peripheral issues that have a significant impact on nutrition? You talked about using an intersectional approach. So how do you identify the different sectors you can intervene in?
Okay. So all of our projects, we have specific teams dedicated to the different sectors. Agriculture and livelihoods, health and nutrition, and we will go in and do formative research to find what other issues might be going on. One tool that we use is called barrier analysis, which looks for the barriers for why people are doing a behavior or are not doing a behavior. So, for example, if it's exclusive breastfeeding, we will try to find doers, people that do practice exclusive breastfeeding until 6 months, and people who are non-doers, and try to identify what are the enabling factors that allow people to do that versus what are the barriers, what's inhibiting people from the behaviors. And that formative research tool is incredibly useful. We find things we wouldn't have thought of on our own sitting in headquarters or regional offices. We're able to talk directly with the beneficiaries to find out what is it that they need, and we can find things from other sectors that just jump into our nutritional assessment, that all of a sudden we see that it's more of an agriculture issue, and then we will team up with our agriculture unit to try to address those needs.
Okay, thank you.
I'm sorry, what was the second question that you asked?
So the next question is FH able to integrate a faith perspective into the frontline work, like care groups or other projects?
Mm-hmm, certainly. So it depends on the region that we are working in, what's already culturally appropriate, but we do have nutrition messages throughout. For example, that children are a gift is one message that we will continually say throughout our programs, and that God loves you, and that you are a gift as one message that we use quite frequently. But it does depend on the context.
Yeah, I would say, not on the advocacy level. I think, a lot, it's the faith message is also important to the advocacy and reaching out to your congressional members. I think there are a lot of reasons to fund programs and, there are a lot of excuses not to. It's, we don't have the budget or whatnot. But as people of faith, there really is a moral argument to this, that the importance of helping people and reaching people because it's a moral imperative. Because as a Christian, God calls me to do this work and to help others. And I think that has a huge impact with members on the Hill. So it's certainly part of our messaging and the advocacy too.
Thanks. So, Nicole, there's another question. Are there specific interventions, perhaps through care groups, that have been proven to be especially effective? And do you follow up efficacy studies of your interventions?
So another intervention that's frequently used is the community, it's called CMAM. It's the community-based treatment of moderate malnutrition. So it's working, we do use the care group structure a bit here. We will empower the women to identify people with malnutrition, specifically moderate or severe malnutrition, using UAC tapes, which are the mid-upper arm circumference area tapes. They're easy to distribute to people in the field, easy for them to carry, and they're pretty inexpensive. So once the people are identified, once the children or women are identified as malnourished, they are referred to a treatment center, either an outpatient or inpatient feeding center. And then from there, they will receive the specific nutrient supplements and commodities and education that they need, but trying to address the needs within the community before sending them to an external clinic.
Okay, thank you. And one other question. Does FH have a platform online on which updated evidence-based approaches on nutrition are posted? You've mentioned care groups, so just, is there something other than care group is maybe what this person is asking?
Not for all of our programs as far as what is available online, but we do keep up regularly with the care group info.org website.
So Ryan, switching to you, someone has asked, how do you measure success of your advocacy efforts?
Oh, that can be hard. Advocacy is notorious for being difficult to measure. You look at nutritional interventions, and it's really easy. It's pretty scientific. Looking at did you do an intervention? Is a child getting better? There's stunting. They're very scientific. Advocacy is tough because the work that we do is over a long haul, and it can be hard to see a final product of a bill introduced. But certainly that end product is a big thing. Have we passed legislation? Have we had an increase in funding? There are successes there, but there are smaller things too. From a perspective here, do we get calls back from your member of Congress? Have they changed on an issue? Do they talk about an issue more? For bills, has it gotten a hearing? Have members of Congress talked about it at all in public? Have they asked questions about it? So, we have seen smaller successes like that, where, member didn't even know what the issue was, but they certainly have become more educated. They talk about it at events or in other things. So there are smaller initiatives too.
Sorry, I was having a problem unmuting myself. Ryan, so someone has asked, if I were to tell someone else at my job about this webinar and advocacy, what type of elevator speech do you think I should give to convince them to do something?
Well, that's good. That's good. Yeah, we should have that. So I would say, when I think about it and trying to reach out to people, I say that global nutrition is something that takes up less than 0.5% of the overall federal budget, but has some of the best actual return on investment of anything that the U.S. government does. Small amounts of money reach millions and millions of families, ending malnutrition and stunting. And by just committing a little bit and making this a priority, we can save millions of lives.
Thanks, Ryan. So I don't see any more questions appearing. I'm sorry if people have sent them to me. I received a few over email and then over the webinar chat. So that means we can close. So I'm going to ask both Nicole and Ryan, do you have anything else you'd like to share, a closing statement perhaps for our webinar audience? And then I'll close this out. So Nicole, I'll start with you.
Sure. No grand closing statement, I guess I should say. Just that thank you very much for having me on this webinar. I really enjoyed it. I really appreciate it. I'm happy to answer any questions. I can provide my email address for everyone. I'm also happy to put you in touch with some of our other sectors if you have more specific questions on our agriculture and livelihoods or our disaster risk reduction projects or our policy work. I'm happy to put you in touch with the right people there.
Thank you. Ryan, anything you'd like to share?
Yeah, no, I just want to thank you too for having me. This is an important issue, and if anything, I would just encourage folks to please call your congressman and representative and let them know that the U.S. really does need to maintain its commitment to global nutrition and build on that, both by co-sponsoring the Global Food Security Reauthorization Act and by committing to increased investments for global nutrition.
Okay, thank you, Ryan. So I hate to say this, someone just sent a last minute question. So Nicole, I'm going to ask you. So what have been the average improvements in the nutritional status of the children in a community? Can you cite examples? Is there evidence of this being sustained? I think it means the improvements being sustained.
Mm-hmm. So off the top of my head, I do not have those figures, but I would be happy to send you more specifically. But we are working to graduate communities from needing our assistance. So eventually it's, we do periodic follow-ups, but they're not as regular. But nutritionally speaking, focusing on targeting people to get them out of severe acute malnutrition or moderate acute malnutrition into the category of appropriate nutrition. So I can find the data for you on that. I apologize, you do not have them offhand. Depends on the context or country.
I think it's okay that you don't have that data at your fingertips. We can share it. I know who asked the question, so we can share it with them and put it on the site. So I just really want to thank Nicole and Ryan for taking the time to prepare and to share, and to everyone joining the webinar on the work of faith groups from programs to policy. And for more new resources on nutrition, we encourage you to visit CCIH's resource page on nutrition, Bread for the World's website, Food for the Hungry's website, the Care Group website. And this webinar will be available for others to view. We've been recording it, and so it will be available online, and you all will receive a follow-up email about that. And I just want to end by saying, you know, we're told in Micah 6:8, he has told you, O man, what is good, and what does the Lord require of you, but to do justice and to love kindness and to walk humbly with your God. So I really hope that everyone is inspired to take action, whether it's to think about your programs differently or to think about how policies really affect these programs and to take action. And I hope you all have a very good day. So thank you for joining us. And blessings on your day. Thanks.